presents with fever and right upper quadrant abdominal pain. As part of his investigation, a CT scan shows an ill-defined lesion of the right lobe of the liver. So it's the right lobe of the liver. What is the most likely diagnosis? So before we head into this, let me just point out the important information here. So it's he's a male patient presented with fever and right upper quadrant abdominal pain. And CT showed ill-defined lesions in the right lobe of the liver. Okay, this is very relevant, and we're gonna tell the diagnosis at the end of this video. So please bear with me. So firstly, I would like to talk about the benign lesions of the liver, which is quite a long topic, but we'll try to summarize it as much as I can. So benign lesions of the liver, okay? So first and most important one, which is very common and present in a lot of people, like 8% of people has this lesion, which we call hemangioma. So hemangioma is basically an oma, which is a tumor of the angio, the blood vessel, some kind of a tumor or collection. So as I mentioned, this is the commonest of all time, okay? The commonest benign lesion of the liver, represent 8% of the population, and it might be enormous. It might be very large in size. And the lesions are normally separated from the liver by fibrous tissue. So if we're saying this is the liver, you will be having here a blood vessel that has a hemangioma, which is collection of capillaries that are separated from the liver by some kind of fibrous tissue on the background. Okay? So on the ultrasound, it will be hyperechoic lesion. Hyperechoic lesion. Very shiny. And this is because it has lots of blood inside. This is quite challenging to manage. It's very important to get an ultrasound to establish your investigate your diagnosis before you go for surgical management. So surgical management is not an option here because it carries a lot of risks. Okay, lots of risks are with hemangioma. Number 2 is the liver cell adenoma. And this is a quite interesting story. It's not very interesting, but adenoma is basically happen in middle-aged female patient in the childbearing period, okay? And most of the time they are using oral contraceptive pills, okay? So most of the patient between 30 and 55, as I mentioned, up to 90% of the patient between this age. And the lesion is usually single, not multiple lesion. So 30 to 50 and single female using contraceptive pills. This is the story. And usually it's very sharply demarcated from the normal liver. So it's very separated, very well demarcated. So regular edge is present. On the CT scan, it will be hypodense lesion on the CT scan, okay? So if the patient is presented to you with hemorrhage, so removal of this adenoma might be required. Otherwise, you will leave it alone. So removal only if there is hemorrhage, okay? So you only remove this adenoma if there is hemorrhage for those patients, okay? Cool. Number 3 is the liver abscess, which is some kind of benign collection as well. Because you will find it in the liver that it is a mass, and you cannot tell 100% if this is an abscess or adenoma or hemangioma. But the small finding, the subtle finding, the difference between them can make you differentiate. So liver abscess. So always, guys, when you think about an abscess, you know that the pathology of it is there is a certain bug that starts to accumulate polymorphonucleoside by chemotaxis, okay? And these will start in necrosis of the tissue until it forms the yellow characteristic shape of fluid, which is pus, okay? So this is the abscess. But always think, when you think of abscess, about the source. The source might be local, it might be systemic as well, okay? It might be iatrogenic, like the surgeon caused it. So the local cause might be from the biliary sepsis, which is not very common, but if it happened, like cholangitis, for example, the ascending bacteria, which in most of the cases is going to be E. coli, will cause liver abscess. Okay? So the common symptoms with this patient, there might be systematically unwell. And by systematically, I mean they might be having fever and deranged blood pressure, and the pulse might be slightly increased, and they might reach up to sepsis as well. Most importantly, they will come with right upper quadrant abdominal pain. And number 3, also the lesion will appear on the liver as hyperechoic lesion. Hyperechoic lesion. Okay? Well, is there anything else that we can talk about? Yeah. There is also a collection in the liver that is called the amoebic abscess. Okay? Amoebic abscess. And this usually happens in people, focus with me here, guys, from the Far East. Okay? Or at which amoeba is kind of endemic. Most of the patient will come with right upper quadrant abdominal pain and fever that is alternating and has been there for quite a long time. Ultrasonography will show you that it has a collection, a fluid-filled collection, fluid-filled cyst or collection, okay, that has poorly defined borders that tells you this is not adenoma and it is not hyperechoic, so it is not hemangioma. Okay, right upper quadrant pain and fever. When you try to aspirate it, it will appear like anchovy sauce. Okay, very pasty, very sticky anchovy sauce. Okay, so this is amoebic abscess. The last thing we have maybe 2 more things to talk about, but there is hydatid cyst. Okay, so hydatid cyst is basically, again, in the Far East countries where they're using, like they have a lot of sheep and a lot of farmers deal with sheep. So from Echinococcus granulosus is the causative organism, and it will lead to multiple cysts that are found in the liver. And these cysts are very big. They might reach up to 20 centimeter in diameter, okay? And typically presents with fatigue, okay? And malaise. And finally, present with right upper quadrant abdominal pain as well. And with the history that you will get from the patient, you will know that this might be a hydatid cyst. You will do the liver function and it will show to you eosinophilia. Eosinophilia will be there when you do the liver function for the patient. Ultrasound will show to you multiple cysts with septi in between. Okay? So you need to know that. So how do you treat this patient? You might give them metronidazole. Metronidazole is a good option to give to the patient, but surgical evacuation is still needed. And for this surgical evacuation, you will need to be very careful for the cyst not to rupture, because if it's ruptured, it might you have done some seeding for this cyst and it will regrow again because it's a very recurrent lesion. So you will need to evacuate it and then put hypertonic saline over the liver to prevent its recollection. Last thing we're talking about is the cyst adenoma. The cyst adenoma in the liver is very rare lesion, and it does have malignant potential. it does have malignant potential. Okay, so ultrasonography typically large will show to you a large anechoic lesion, anechoic lesion. It's not echoic at all. That means it's not hemangioma. Okay, and surgical resection will be needed for cyst adenoma because it does have malignant potential. So guys, if we go back to our question, you have here a 25 man, so he's young, and basically he is a man, not a lady, and that like gives you just a little idea that I am not adenoma. Mostly I am not adenoma. Okay, but and also adenoma is from 30 to 50, if you remember that. So I'm not adenoma. From the Far East, it tells you something. Either it is high dated cyst, or it is amoebiasis. Okay. Presented with fever and right upper quadrant pain, but did not mention malaise, did not mention the teeth being a farmer, so that tells you I am amoebiasis. Okay. Also, the CT scan showed ill-defined lesion on the right upper quadrant. Amoebiasis is very common in the right lobe of the liver. Okay, so the answer will be amoebiasis. Thank you very much.